website later for folks that weren't able to listen in today, so that you do know that. If you do have any questions throughout the webinar, you are welcome to send them in the chat box that you have on your control bar. If you are not able to send in things through the chat bar, you can also, we have our email address at the end. We can also send in emails as well. So let me introduce myself. My name is Katie Dively, and I serve as a research scientist and also a trainer and a community guide for the Center for Health and Safety Culture. I'll explain what that means, what the guide service means. That's the whole point of the webinar, so I'll explain that soon. But while I do work at the center, which is in Bozeman, I reside and I work out of my home in Wisconsin. My background is health promotion or public health, and I've worked at the Center for Health and Safety Culture for about 7 years now. And I will turn it over to Jay Otto, who is my co-presenter today. Jay, why don't you introduce yourself?
Sure. Thanks, Katie. My name is Jay Otto, and I am a research scientist as well with the center. I try to oversee and help coordinate all the different projects. My background is actually in engineering, but I also worked at the community level doing a lot of prevention work on a variety of issues. I, like Katie, am a remote employee, so while I work full-time for the center, I actually live in West Virginia. So our staff, we have about half of our staff is remote and half is on site, and we have many of the W states covered. So we've got West Virginia, Wyoming, Wisconsin, and Washington. I'll turn it back to you, Katie.
Great, thank you. So the agenda for today's webinar, I'll just briefly highlight what we'll be covering. We'll first talk about who we are. Who is the Center for Health and Safety Culture? Jay will provide you actually with a brief overview of the framework that we work with, which is a positive culture framework. We'll talk about the purpose of guide service and why we decided that guide service was sort of a missing part of the prevention community or prevention services offered. We'll specifically describe what that service is. We'll have an opportunity to hear from one of our guide service clients who's on the phone with us today. And lastly, we'll talk about the requirements for guide service. So with that, I'll get started with a little bit of an overview of the Center for Health and Safety Culture. We're located at Montana State University, which is in Bozeman, Montana, and we are housed within the Western Transportation Institute. Our purpose that you can see on the screen is that we are an interdisciplinary center serving communities and organizations through research, training, and guidance to cultivate healthy and safe cultures. Okay, so kind of what does that mean? Interdisciplinary means, as Jay mentioned, he has an engineering background. My background is public health. Our whole staff comes from a variety of backgrounds. Actually, I don't think any two of us have the same degree. So we have engineering, public health, we have education, organizational leadership, prevention, science, psychology, sociology, and a variety of different backgrounds and wisdom coming into the center. Our main purpose, our main work at the center is to serve communities and organizations by taking what we know from research, either research that we've done ourselves or partnered with other agencies to do, or even other organizations' research, and transfer that knowledge through guidance, which you'll learn about today, to cultivate or grow healthy and safe cultures in communities and organizations. There are three core issues that we focus in on at the center, and while we might work individually with a community that works on a different issue than you see here on the screen, these really are our priority areas. And I imagine that all of you on the phone can probably see some sort of relationship between them as well. So traffic safety being one of the leading causes of death in particular age groups is often associated with substance abuse, right? So impaired driving is a serious concern in many of our communities. Substance abuse is a major issue with lots of the clients that we work with, either trying to reduce underage drinking, reduce marijuana use, or even the misuse of prescription drugs, or all of the above. And we also work in violence prevention. So while that might be related to domestic violence or teen dating violence, just to name a few. I bet you see how substance abuse can be tied to cases of violence, and often alcohol and drugs being involved in those situations. Child well-being is also another focus area for us. Improving environments where youth can thrive is absolutely critical in all of our communities, and unfortunately we do see that relationship between child well-being or child development being impacted by adverse childhood experiences, or ACEs as you may know them, which of course can be related to substance abuse or violence within the home. So while these four issues seem a little bit separated, they really do have a lot of interrelationship as well. You can see here a map of the projects that we're either currently working on or have worked on in the past. And I encourage you to go to our website, which I'll post on a screen in just a few minutes, but I'll encourage you to go to our website, because if you find one of these bubbles near you, you can click on it on the website and find out what that project was. Some of the larger balloons on the screen are statewide projects that we engaged in, and some of the littler ones are specific community or organizations that we worked with. But you're welcome to go to our website and find out more about any of the groups that we've worked with in the past. What I'm going to do is turn this over to Jay now, and Jay is going to take it here for a little bit. He'll describe what we might call our logic model for the Center for Health and Safety Culture, and he'll also do an overview of our positive culture framework.
Thanks, Katie. So we very much view our core purpose, and all of our work focuses around improving health and safety. So when you think about a very simplified logic model, as what you see on the screen, you sort of begin with the end in mind, what's on the far right. We are all brought together around the personal mission of improving health and safety, and that's really reflected all of our work. We are a part of an institution, and we do primary research. And we think that's very important, because there are ways that we can learn new approaches to improving health and safety. But we also believe that we can't end it there, that we have to do more than just publish papers. While a lot of academics read published work, a lot of other folks don't, and it's actually not the best way or the only way to help bring the knowledge out. So a critical component of what we do is also figuring out, okay, so how do we transfer what we learn or transfer this technology to the field, to communities actually doing the work on the ground. And that's that center box or the middle box around building capacity. And that could be capacity at the federal level with federal level leaders. It could be at the state level with state leaders, but it's absolutely at the community level with the folks doing work in their communities. And we have to look at that in a variety of ways, and that's really what we're going to dive into a little bit more here, is one aspect of how we do that. Of course, that's hopefully leading to effective implementation, which then allows us to improve health and safety. So this is a very high-level image of sort of how we view our work. I think it's a little bit different than some organizations that may focus on just one aspect of this. We're trying to look at all the different aspects and how they tie together. We also know that as we work with communities, we can get a better understanding of what's really going on, which then feeds back into the research. So instead of a straight line, it's really a loop as well that brings us back to what we need to understand and learn as well. So if you want to go to the next slide, I do want to give a brief background about our approach called the Positive Culture Framework, and this is just because I think it's better to understand guide service in this context. We organize a lot of our work in terms of improving health and safety around this framework, and we view a framework as very different than a program. It's really a way of organizing our work. It's very abstract. It's not specific. It actually applies to each one of those issues that we address, as well as lots of other issues. And we really think of it as this broad lens to organize our work. So if we can go to the next slide, we can sort of see the differences between classically what we think of as a program or a strategy. On the right-hand side might be very specific actions. It might be a curriculum. It could be an adoption of a specific policy. It's maybe hopefully research-based or evidence-based, and it's very much addressing a very specific issue and perhaps a specific behavior. And what we're looking at there in terms of implementation are issues of fidelity. How well and are we following what was found to work in the past when we implement it? On the left-hand side, we really view a framework as different. It's a way of organizing our work. It's a very generalized process. It involves developing skills, and this becomes really important as we think about building capacity, technology transfer, and in particular guide service. How are we building skills? Because this is going to be a process which an individual, a coordinator, or a coalition engages in repeatedly over time. And when we think about quality, we're thinking about quality of implementation. A little bit different than fidelity. It's harder to define fidelity in a process where there are lots of variables and each implementation may look slightly different. Great, if you want to go to the next slide. So this is basically what our framework looks like. We're going to break it down piece by piece and talk to some of the elements. I just want to give you a high-level view, and that'll help you ground sort of why then guide service and the guiding work we do makes sense. On the left is generally a description of a process, a context, and skills, and on the right is the outcome. So if we go to the next slide, and focus on what it is we're trying to achieve, again, begin with the end in mind. We like to ask that question, what's in the green arrow? And ultimately, we're always viewing this through the work of improving health and safety. But we know to get there, we're going to need to increase protective behaviors and decrease risky behaviors. It's not enough just to think about one. We need to think about both. And there's really been, I think, a transition in the past decade of recognizing actually the work may lean more towards growing protection than just reducing risk because we have more opportunities to do that. And then that begs the question, okay, well then how do we get people to change behaviors? And this isn't just the people who are trying to directly impact. Let's say if we're working on underage drinking, we can't just focus on underage youth. We need to think about behaviors across the community. And so how do we get parents to change behaviors, or law enforcement, or leaders? So it's a wide variety of behaviors. Well, prior to that, we're going to look at and try to understand what are the beliefs that are shared within a community that start to influence those behaviors. And we call those shared beliefs cultural factors. And what are the cultural factors that start to influence increasing protection and decreasing risk? And those vary for each community. But then how can we measure those, grow those, and sustain those so that we really start to impact and grow a positive culture? And that's in essence how we're defining a positive culture. It's a culture where beliefs, attitudes, and behaviors improve health and safety. So that's ultimately what we're going at. Again, as you can see, that's very abstract, and we could put very specific details in there depending upon the issue. If we're trying to reduce underage drinking, that looks different than if we're trying to increase seatbelt usage. But the general framework and the process and the idea of thinking about it, of what's in the green arrow, still applies. So on the next slide, we can start to think about, okay, so how do we do this? Well, we want to lay out a process. There are some steps that we can go through. And yes, they are somewhat abstract steps. And if you've seen a variety of planning processes or strategic planning processes, these steps are not radically different. A couple of summers ago, my research was to do a synthesis of a wide variety of processes to change behaviors or improve health and safety. And this is really a distillation of many of those different approaches, and they all do have similarities. We lay out 7 steps. We're not going to go into those details now, but we do have sort of a very much a specific process, and there are things, lots of activities and tasks we would do within each one of those steps. It's going to look different in each community. It's going to look different with each issue, but it's also going to look very similar. And we very intentionally lay the steps out in a circle because we know the process is never done. And we will go around the circle numerous times as we continue to delve deeper into an issue, we broaden into other issues, or we continue to improve in the health and safety of our community. But learning these steps is a lot of knowledge, and it's a lot of skill. It's a lot of practice because it never looks the same, and there's so many variables that come up in community. On the next slide, we want to recognize that to be successful at the steps, we need certain skills. We need to grow some very important skills, and those are listed on the outside: leadership, communication, and integration. We very much recognize that the work of improving health and safety is an act of leadership. So those doing the work need to bolster their leadership skills, basic leadership skills, how to craft a vision, very basic, lead a meeting, develop agendas, those sorts of things. We don't focus as much on that. We'll aim folks to where they can develop skills in those. There are lots of general resources there. We really want to focus on some of those leadership skills that come about when we start taking a cultural approach. And this is where we're going to start looking at aspects of transformation. And when we really start to grow a new culture or shift a culture, we're really looking at not a simple change, but transformation. And that transformation requires different skills. There's going to be times where we're going to get pushback. We're going to create anxiety in the work that we do. And we need to empower our coordinators and those doing the work to be successful at that. And that's a different layer of skills. So we work on some critical leadership skills. Communication is a part of everything. We're not going to change beliefs without communicating. And so developing our communication skills and how we can leverage communication to change belief and grow positive culture becomes extremely important. And finally, integration is extremely important because there's no one strategy we're ever going to use in our communities to address these complex issues. It's always going to be multiple strategies. We like to say there's no silver bullet, but there is silver buckshot. There's multiple strategies that can come together. We need to learn some skills about how to manage that, how to navigate that, how to identify which new strategies and programs we need to bring on board and which ones we need to sunset. And that conversation never ends because the science is always revealing new ways to do the work. So integration becomes extremely important as well. If you go to the next slide, we also recognize the context where we're going to do the work. And that's listed, that's shown in the very middle of this diagram in the purple, which are the nested layers of the social ecology. This is a recognition that if we're taking a cultural approach, we can't just work with one subpopulation or one group. We need to work with all the layers within a community because that's where culture resides. That's how culture is taught. And that's how our opportunity to really sustain the improved health and safety, because if we can get all the layers of the social ecology to start to increase protection and decrease risk, they will teach and reinforce one another, and then those efforts can be sustained over time. And that's going to involve issues like policy, practice, rules, curriculum, activities at the family level, activities at the individual level. So it's a wide variety of strategies, but we really want to bolster our thinking to think about it through this broader lens of the social ecology. So if you want to go to the next slide. So the social ecology becomes extremely important. And I think we can all see an evolution that's occurred in prevention, where in the early days of prevention, we were heavily individual focused. We thought about what program can I bring to elementary school, middle school, high school that will help kids and decrease, let's say, underage drinking. But over time, we really evolved to recognize it's much more than that. And we had, I think, a big shift to where we said, it's all about policy. And absolutely, policy is critical. But when you think about policy, that's really often at the community level. Now what we really look at it is we need a broad array. We need strategies at every level. We need to really think about this systemically. And it's going to involve individual programs. It's going to involve family programs. It's going to involve school policy, workplace policy, as well as community policy, which might be laws, and enforcement of those at all those different levels. So a cultural approach really means we're thinking broadly across the social ecology. And this is where when you start taking all these different pieces that I've said very, very quickly, we can recognize, yeah, we're viewing this work as a lot more than just implementing a program within a community. And that's where we think about the technology transfer. Okay, so how do we build the capacity of folks to successfully do this? This is a bigger task. This looks different. And that was really the birth of where guide service came from, because we recognized you couldn't just come and learn a little bit about this in a few-day training and then go home and be successful. It was going to be way more than that. If you want to go to the next slide, we really want to start transforming fundamentally how we think about this. And it's not thinking about, let's say, underage drinking, how do I get youth not to drink, which is often where a community will begin. But it's what actions do I want to grow across the social ecology to reduce underage drinking? And then, of course, that just begs the question, well, how am I going to grow those? And how am I going to put systems in place that make that happen? This is turning it into a much bigger challenge in some ways, but we feel long-term that's the place we've got to go, because we really want to embed health and safety in our culture. We don't want to just be having to do a different program now that a different substance comes up or something like that can turn into whack-a-mole. We want to really take this broader cultural approach, but it does make things a lot more complicated and needing that deeper level from a coordinator at the community level who's implementing it. Okay, if you want to go to the next slide.
Sure, and I can take it from here, Jay, and I think that you're right. It involves a much more complex, a bigger way of thinking if we're truly going to transform the community. And that sort of brings us back to the fact that we really are trying to grow solutions in the community. It is more, like you mentioned, it's more about than just implementing a program at the individual level. It's engaging in this really complex process. And as you mentioned, it's hard to teach that in a couple of days or in a couple of hours, and it's really the origin of the guide service that we're here to talk about today. It's really about trying to, address that challenge of building the capacity about a much more complex approach to prevention. So with that, I really want to ask a polling question. It just raises this question about, acknowledging that there are limitations. We know this. We provide trainings. We know that there are limitations in trainings, but we acknowledging these limitations of training, but to really grow skills and have them practice at the local level. So I'll ask the question, have you ever attended a training, heard insightful ideas, and ended up applying very little of what you learned? So if you want to take the poll that you'll see on your screen here, you can either just click yes or click no. You have, if it started, if I'm correct, we've got, let's see. Is there a way, Erica, to restart the poll?
Yes.
Thanks. Just so we can get everybody's, I think I created too short of a time span for me. And if we're not able to, up here it is again.
Tried it with 30 seconds this time.
Okay. So the poll is open. You can answer if you've ever attended any kind of training in your sort of professional experience, heard insightful ideas, but ended up walking away applying very little when you got back to work. How would you respond, yes or no to that? And Erica, are you able to share the results?
I am.
So we'll see, hopefully we'll see what comes up here. Tell me if I need to do anything. I apologize to the audience. This is our first time using polling.
It should be shared.
So those that did answer the question, everybody that answered the question said yes, they have attended a training and heard insightful ideas, but they walked away not applying those concepts. And that's exactly what we felt as well, and what we heard from the communities that we were working with, is that they struggled to put that knowledge into practice. So if we go back to the logic model that Jay discussed earlier, we recognize this building capacity. This orange box here is really essential to this process here. It's got to be a critical part of our research and our work. Just creating knowledge through either research or training isn't enough. We know that we developed this guide service to sort of bridge that gap, a focus on developing new work practices and the actual application of your new knowledge. And it's really, this practice of what you learned with some support so that you can be more effective in your prevention efforts. So I liked this. Our team has done some research on this transfer of knowledge, going to a training and then really applying it or practicing it when you come home. And I'll just read you this, what we found in one of the bits of research. It says that although employees may gain new knowledge and skills through training programs, learning alone is not sufficient for training to be considered effective. Of primary importance is the positive transfer of training, or the extent to which the learning that results from training transfers to the job and leads to relevant changes in work performance. And that's key, right? Why go to a training if you're unable then to apply that knowledge and lead to an improved performance in some respect? And again, that's exactly why we created the guide service, was to move from that book knowledge that we can gain either through a training or through reading into that practice within the community. And it's about developing your skills. It's this post-training, individualized support offering a range of services that really seem to be missing from the prevention services when we developed it about 10 years ago. And I really want to underscore that word individualized. I think that that's one of the unique parts of the guide service, is that it really recognizes you as a community or you as a prevention coordinator or leader to say, where are you at in this process of either developing your skills, or where is your community at in terms of their readiness to address the issue, meeting you at that point, and then nudging you further along the process. So that's really an individualized support. It is not a, one-size-fits-all. We do the same service for every community. That's certainly not it. And it's really about growing your prevention leadership. Jay mentioned before that we see prevention as an act of leadership. It definitely is. You all are leading people to healthier and safer lives. So the service is really about guiding you in a process of developing your skills as a leader to apply the knowledge that you now know, and also to help build the skills of others doing the work with you so that work one day is sustained. And again, that would be a huge goal of our work, so that the work is sustained over time and that improved health and safety is sustained. So what kind? You might be asking, okay, well then what is it? Like, what kind of support is provided? Well, you kind of define it based on what you need, but we provide tips and tools for implementing the positive culture framework. Whether that is, we meet with one another and you say, I really need help right at the beginning of developing a coalition. Okay, we can provide insight and tips and tools there. Or maybe you need, help identifying stakeholders for your issue and engaging them. Or you have a bunch of data in front of you and you really don't even know how to start reviewing it, to even prioritize your data and determine what evidence-based strategies you need to look at. That's all part of the support that can be provided through this guide service. One of the things that I hear quite often from communities that I guide is that they really appreciate that we help them maintain progress through the 7-step process. So we all know that work and life get in the way of our plans, and if you have this great plan to implement the 7 steps and improve health and safety, a lot of things happen when we go to implement that plan, and the guide service is really there to check in with where you're at, assist you in moving forward to that next phase when you're ready. Another benefit I see and I know the communities that I work with see, is lessons from other communities. So we work, you saw the map, we work with a lot of communities and organizations and states across the country on a variety of topic areas. But I think the best part I feel about my job is that I get to share, well, actually I get to learn first from all of them about what it looks like to actually practice and apply the framework at the local level. And then I get to share that with others. So when issues come up, when communities are stuck in challenging situations or they have roadblocks, they can call and I can say, you know what, I've heard of that before. I've worked with another community who was in a very similar situation, and here's how it worked out with them. Or, you know what, I might even be able to put you in touch. If they're willing, I might even be able to put you in touch with them. Or, you know what, here's what we know from the research. I'm able to be able to guide you in that way. But it's nice to know that you've got lessons from a wide breadth of not only research, but also from other communities engaging in very similar efforts. And then there's always also a level of coaching for you, as a prevention leader in this work. And that's just like support and encouragement and continually nurturing your leadership skills, which are so important to the work that you all do. So that's kind of what services are provided. But again, it's really up to you. I mean, my work with every single community that I work with looks different because either the topic area is different or where they're at in the work is different. So it's really not a one-size-fits-all. So what does it actually look like? Well, at minimum, it looks like monthly phone calls. So while I want to have at least a minimum monthly check-in with you so that we can have a conversation and work through the process, it absolutely doesn't mean that we're only limited to those monthly phone calls. I often have a community that'll email me or call me and say, hey, do you have a quick 15 minutes to chat? I've got an issue that came up and I really need some help with it. That happens all the time, and that's great. That's why the service is here. And there's always email support. This is probably my main method of contact with communities that I work with is, continual emailing back and forth, whether it's, hey, can you review this document? Hey, can you give me feedback on this? We absolutely have a lot of email contact back and forth. As part of the service, you have access to a private online community of practice, and that is a community of practice website that others who are contracting with guide services have access to as well. We developed this community of practice website because we heard that communities wanted something or a place that they could go to not only find tips and tools and materials, but also to contact and share items with each other or ask questions of each other. So we developed this private community of practice, which really serves as a repository of prevention materials, sort of set up according to the framework. So if you're working in, you saw a very quick overview of the 7-step process, but if you're working in one of those steps and you really want some tools for assessing the culture, you can go to that portion of the site and download some tools. You also have the opportunity to communicate with others. There is definitely a place on there where you can ask a question of your colleagues. Unfortunately, I don't see that portion of the site used as much as it once was, but nonetheless, it is there for folks to use. You also have access to our entire staff. So there's a couple of us on the phone call today, but we do have a larger team all across the country with a variety of backgrounds and wisdom, but also affiliated professors at the university. So it's nice to know that you, through the guide service, have contact. If I don't have the questions, I certainly take it back to the team and say, hey, we've got something that came up. Let's all huddle around and try to figure out how we can help this community out. At the end of the service, which is a 1-year contract that folks enter into, I provide an executive summary, which is a report that's created based on all of the notes that I've taken throughout the year. So I make notes during our monthly phone calls. I also keep notes if we've made contact in between, just so that I kind of know where you're at every month. And at the end of the year, you're provided with a report that highlights the format of the report is according to the framework so that we can touch on specifically, how are the leadership skills going? How are the communication skills? How have you worked on integration or engaged in the 7-step process? So it really highlights your successes in those areas. And it also mentions and creates recommendations for next steps. So while I might have done, a lot of work this year in step 2, assessing cultures, now you'll have some recommendations of how to move to the next step. And I think the thing that I love most about when I work with communities to discuss the executive summary that they've been provided, the thing that they seem to focus in on most, which I think is fun, is that they're overwhelmed by the amount of work that they did in the last year. And I think it's so easy for us to forget all that you have done, or you make things seem trivial, right? Oh, I got that stakeholder on board, and it might have been the mayor. Well, actually, that was a really big deal because it helped you, get these other stakeholders on board, or it helped you pass a policy. I mean, that was an integral part of your work. And the executive summary sort of, draws out and highlights those successes, and it's nice to take a moment to reflect at the end of the year to say, wow, we really have done a lot, and this is a document that I can share with my coalition or that I can share with my funders. To shift gears just a little bit, I want to talk about an evaluation that we did this last year on the guide service. So we were really interested in learning more about how folks received, what our clients thought about the service. We also wanted to know how could we improve the service. We didn't want it to get stale. We really wanted to incorporate new information and new knowledge. So what we did was we connected with a graduate level evaluation class at Montana State University. Dr. Eric Austin was the professor of that course, and he and his students engaged in a semester-long evaluation of the guide service this spring semester of last year, really to help us understand how people see the service, how they're benefiting from it, and what improvements we could make. So what this class did was they provided, or they received a bunch of background information. They had informal discussions with our staff just to get them acquainted with what the service was. They looked at a bunch of our documents, meaning our contracts and different reports. And then they did some informal initial interviews just to get a sort of a lay of the land. When it came to the data collection piece, they conducted interviews with each one of our staff members to discuss guide service, to talk about how it worked, maybe how it could be improved upon, et cetera. And then they created a survey tool that went out to all of the current and the past clients that we worked with as guide clients. And then they also reported, or they took a look at all of the quarterly reports that are completed for each of the communities that we work with as just something that we do for the university to show them how we're working with each of the communities. So after doing their evaluation, they provided us with a large report. And what I pulled out for you today were the findings of the client survey. So clients who responded to the survey had very positive personal experiences with the service. They felt that the guide that they worked with was easy to work with and understand, and that they felt that this goes back to that individualized service. They felt that it was that they were one of the guide's only clients when, in fact, that she had been working with others. So that is the goal. That is the goal, is to be sure that you are receiving individualized attention because your community is working through different issues than another community might. I mentioned earlier that leadership skills were, building these leadership skills were an important part of our guide service, and 100% of those that completed this survey said that their leadership skills improved, and 100% also said that they used those leadership skills. And that's entirely the point, right, is to put those skills that they're learning into practice. And the overall satisfaction rating was that 100% of them said that, or ranked the service either a 9 out of 10 or a 10 out of 10. So enough about the evaluation of the service, and just so that you know, we learned several things also that we can structurally improve upon how we provide service and things like that our team will continue to improve upon, and we'll continue to engage in research so that we can always learn and improve this service for the clients. What I would like to do now is provide you with an opportunity to hear from one of the guide service clients that we have now. Her name is Rachelle Olsen. She is the project director for Tonka Cares, and Tonka Cares is in Minnetonka, Minnesota. But Rachelle, if you can unmute your phone, I'll have you introduce yourself.
Hello, can you all hear me?
We can, thank you.
Wonderful. Thank you for having me on the call today. I'm excited to talk to everybody a little bit about my experience with the guide service. Like Katie said, I am in the Twin Cities area in Minnesota, and I've been with the coalition for about 5 years now, and 3 years in this position. And I've had the joy of being a part of the guide service with Katie for about 3 years now. I'm excited to talk about it.
Great, thanks. So what I'm going to do is I'm going to ask Rachelle a couple of questions, and then she'll just provide her insight here. So why don't you explain for the group how you utilized the guide service?
Yeah, I was thinking about that a lot as I reviewed the slides that you were sharing, and I think that we have probably utilized the majority of the pieces that you offer, and it's really all been very helpful. So I think what we've utilized the most would be the monthly phone calls, and that's been a marvelous way to really check in on all aspects of our coalition's development. And sometimes it's easy to not see the big picture of everything you're doing and all of the steps on a daily basis. So that's helpful. And then also the ability to ask specific questions and discuss challenges during that time. And Katie, you've been really great at sort of building us up for what we've been doing well, because that's easy to overlook. And so it's nice to get a little bit of a pat on the back, or even to realize that we've been doing something well and not even known it. So when you said something about, oh yeah, we got a mayor on board, I could relate to something like that. It's easy to not understand the accomplishments you've made on a monthly basis. And then we've also emailed Katie quite a bit, and that's really helpful when we have a pressing question between the guide calls, or if we're looking for a resource. She's really great at providing resources, and we always get a really prompt and thoughtful response. And then we've also utilized the center for some analysis of our data. So Jay actually looked at our student survey data when it came out a couple of years ago, and we were running into the issue where we only had 9th grade data and 11th grade data, and we didn't quite know how to say overall what was happening for our total high school. And so Jay was able to look at our data and compare it to national data, and let us know that our 11th grade data would serve as a good proxy for our overall high school, and gave us a really nice report that we've been able to reference several times over the years. And so I think all of this it's really good feedback to also bring to the coalition to say, you know, we have someone that we speak with regularly, these experts who can provide feedback about the process we are using and the framework under which we work. And that's always taken very well by the community members that we work with.
Thank you. What would you say is the most beneficial aspect that you've received, or what do you find most beneficial?
Probably the problem solving that we're able to do with you. So if we're confronted with a barrier, you know, oftentimes we'll have issues such as a poor response rate on a student survey, or maybe building a relationship with a new principal. And these things might seem small, but they're really important for the work that we're doing. And so it's really helpful to talk through all of those issues with our guide and troubleshoot solutions. And so we're quite often, you know, literally guided towards the right answer through the conversations. And by, you know, posing helpful questions, our guide has really been able to help us get to the answers on our own, which builds those problem-solving skills that are so crucial for this work.
Awesome. Well, Rachelle, thanks so much for sharing. And I know folks have questions at the end, so if you don't mind sticking around, perhaps somebody might have a particular question for you about the service.
Sure.
So let's talk about some of the requirements, really 2 requirements that we have before you can engage in the guide service, and that's really that you attend one of our full trainings. Our full training is a 2.5-day positive culture framework training, and that's required because the service is really about helping you implement that framework and put that into practice at the local level. And without that training, it's incredibly difficult to do that just over the phone. So we do require that training. We either offer open trainings where anybody can come to a training and learn more about the framework. We also are able to provide on-site training where we come to your community and train your community, stakeholders, coalition, whomever that might be, and do that personally for you and for your issue. So it can look a number of different ways, but that is one of the requirements of guide service. And then the other requirement is that you pick one person that really serves or is identified to work with the guide. And we've learned this through our experience. So over the past 10 years, we've really learned that it's about building the skills of that main leader, that working with multiple people, on the phone becomes really difficult because we've got multiple leaders doing multiple things. So the goal is to build the capacity of that one leader, and then, of course, for them to be able to go and share that knowledge and relay that information to the rest of their team. So we require the training and then to identify one leader to work with the guide. In terms of training, you might be asking now, well, okay, well then, how, if this is something that's really something that I could use or benefit from, when is the next training? And we do have another training coming up here in December. It will be held in San Diego. It's the 7th through the 9th of December. It'll be nice to check out San Diego in December, especially since I'm coming from Wisconsin. So that will be nice. You can certainly learn more information on our website. Our website is CHS Culture, so Center for Health and Safety Culture.org, and then specifically for the training you can do /training. This is an opportunity, again, for you to engage in more than just a 5-minute overview that Jay provided earlier, but to really engage in a training with other people across the country working on different topic areas, learning how to apply the framework at the community level, but also while you're in a training setting, develop some of those skills relating to leadership, communication, and integration. So with that, what I'd like you to do, we've got about 9 or so minutes left. I would like you to ask any questions that you have. So unfortunately, in the mode that I am at presenting, I am unable to see if any questions came in while we were talking. So I'll have Erica do 2 things. Erica, if you can unmute folks' phones if they would like to ask questions, that would be great. And also, if we've had any questions that have come in, would you mind reading those to me?
Absolutely. So everyone is unmuted. I have not gotten any questions.
Great. If anybody does have a question, feel free to chime in.
Hi.
Hi.
I'm Chelsea, and I participated in a 1-day training. It was only 1 day in Gallatin County, Washington, so I wasn't sure if that would then disqualify my organization from participating. It was done by Jay, mostly focused on social norms. We did receive the PCF binders.
So, Shelley, I'm glad that you asked that question. Thanks. So this is a common question that we do get, and something that actually we didn't touch on in the webinar is that the positive culture framework is an evolution from what was the positive community norms framework, which some of you might be familiar with. We have provided a variety of different trainings, 1-day trainings on communication or social norms that you may have received, like you said, 1-day overview sessions. But unfortunately, to engage in the guide service, we really do need to have you trained in the full framework, which is that 2.5-day training.
Okay, thank you.
Thanks for asking. Any other questions? We definitely have the option of if you think about questions, the more you think about this webinar and questions come to mind, you are welcome to email us at mail@chsculture.org and ask any questions about the service, either this service, guide service, or other services that we provide, such as training or survey work or any of our other services that you find on the website. But I will check in once again to see if anybody else has any questions. Well, hearing none, what I will do is thank you all for participating with us today. What we will do is we will put a recording of this webinar on our website under trainings. You can scroll down to the bottom of the page and find those pre-recorded webinars where there are other webinars as well. If you want a more in-depth review of the framework, we've provided a webinar on that in the past, and that's recorded on that page, so you're welcome to visit that or guide your colleagues to do that as well. So again, I appreciate your time to spend with us today, and if you have any questions, please send us a note through our website. Thanks so much, everybody, and hope you have a great day.
Thank you, everyone.